Through neuropathology studies, we know that after autopsy, subjects who have Alzheimer's disease show neurodegeneration. And then we've also been able to see through staining that synaptic proteins such as synaptic vesicle glycoprotein SV2A, which is what we're imaging with the PET radiotracer UCB-J, that they are decreased in subjects with Alzheimer's disease. So with this study, we are hoping to look at people who have Alzheimer's disease, but primarily people who have mild cognitive impairment, so like the earlier cohort, in order to track them longitudinally to see how their synapses are degrading with disease progression. So for disease progression, we want to look at cognitive scores and also beta amyloid accumulation using PET, Pittsburgh compound B, and then neurofibrillary tau tangle accumulation using F18 MK6240. And then in a previous conference, I gave a presentation showing that so far, now our data is very skewed towards cognitively unimpaired amyloid tau negative subjects, but we're seeing that there's no relationship with UCB-J uptake focusing on in the hippocampus when comparing it to global amyloid uptake or with MK6240 uptake in the entorhinal cortex. For this conference, I primarily focused on showing the results that we did with the Ray Auditory Visual Learning Test, the 1 through 5 score, and then also the RAVLT7 scores. And what we saw was that there was a strong relationship. And again, this is all preliminary data, so we'll see as we acquire more subjects. We have about 40 subjects now, and we're hoping to get 122 time points. But we are seeing a relationship between UCB-J uptake in the hippocampus with both of these cognitive measures. The study's ongoing. We actually just started scanning our second time point subjects. So I think as we kind of try to understand what UCB-J is measuring, because we know it binds to SV2A, but how that relates to synaptic density, I think that the longitudinal data will really help us with that. And I know that there have been retest papers put out that there's little difference over time. So hopefully we'll still see that with our control subjects. But going forward, we're also going to be looking at different cognitive measures, kind of what was brought up by the Yale group and their analysis, and looking at possible like partial volume correction of the data. And then overall, without just focusing on the hippocampus, are we seeing variations in UCB-J uptake, even in our cognitively unimpaired subjects? Because we're seeing this relationship so far between this UCB-J uptake and then cognitive impairment, we're hoping to see more if we see any relationship with amyloid and tau as we start to get more subjects who actually have significant accumulation of those. So then we'll be able to hopefully determine how UCB-J interacts with these other indicators of disease progression. With Alzheimer's, one of the big questions is how can we sort of diagnose someone even before they start to see clinical symptoms of the disease, and how can we help them at that point? So I think with UCB-J, we can help with the event timing, even potentially before we start to see amyloid accumulation. But I think that before we draw any conclusions about UCB-J in the realm of Alzheimer's disease, we just need to do more imaging, more subjects with it. But that's what we're hoping to see.